My name is Teresita Manluco. They always call me Teng here. I am a nurse. I'm a nurse care manager, and I've been here since 1996. So figure it out. Almost 30 years I've been here, and I always say 28 years in service.
My name is Jessica Charlton. I am a registered nurse. I have been with the Infectious Disease Division and CART for a little over three and a half years. I started here as clinical research. Now I'm the patient care manager. And I've been doing that for about 2 years.
My name is Deborah Campbell. I'm a nurse here at CART. I've been with the hospital since 1996, and my position has grown over the years. I did work with the HIV Hep C population for some time, and we cured all of our patients. I think we had a 100% cure rate here. So now I am a case manager, and I work in various parts here at CART. Case managing patients, working in our travel immunization center, and taking care of the patients.
So as a patient care manager here, I provide support to a team of about 22 nurses and medical assistants and research staff that are just within this one division here. And I also provide clinical support and help throughout the service line. I have nurses in Manhattan, out in Bay Shore, Dolan in Huntington, Regal Park, Queens, Staten Island. And I'm just here as the main point of contact for them if they need any kind of clinical support or help, anything we can do for our patients.
Unity is not only among us workers over here in infectious disease, but it has something to do with patients too. It has something to do with how you deal with everyone, how to work with each other in a better way, because I believe that there should be cooperation among us, and we should work hand in hand, not only regarding my patients, but taking care of everyone. It's what they call working together. Together we will overcome all the obstacles in this division.
Unity is that when whatever we have going on in our individual personalized lives that make us happy or make us sad or enrage us, we can bring it together and lean on one of each other and help each other get through the day and help make a difference and make someone happy that day. That's what unity is to me, doing good.
So what unity means to me is really everybody working together, our staff, our nurses, MAs, front desk, in conjunction with the patient. So the patient is part of the unity. It's everybody working together to meet the same goal. We may get there different ways, but our goal is to keep everybody happy and healthy. And especially nowadays, with everything that everyone has been going through, the climate in the nation and post-COVID, I think it's really important. So it's not only a physical health, but it's a mental health as well. And here at CART, I think we really do try and obtain our goal with all of our staff. We have social work, doctors, psychiatrists, health educators, nurses, MAs, as I said, the front desk. We have an abundance of people working together to obtain our goals for the patient.
Our team here, we provide any kind of support that you would need when you walk through these doors, whether it's emotional, whether it's physical, whether it's just a silly joke and a conversation that you need to get you through the day. We are here to help you follow up with your healthcare, help you get the things you need, help you, understand the world. If there's something you don't know, we have a team to explain it to you. If there's a new medication out, we have a team who's going to try to get you enrolled in that trial. We go above and beyond for all of our patients because this whole team is so dedicated to the cause and dedicated to, you know, each and every person that walks through this door. Shortly after I had my son, and I joined in the Division for Clinical Research. I love clinical research, right? The whole point of clinical research for any kind of disease process or, you know, anything is great. I think there's been so much progress throughout the world, and any time we can make anybody better is very important. And then it was around the time when Mpox first started here, and there was the initial outbreak, and it was, you know, big and fast, and what was going on. And my predecessor, Pat, who was the patient care manager here for years, was on vacation. And there was no one kind of to start the project. And I was in clinical research. It was, you know, it's sort of related. So I ended up starting the project. And that was like, you know what? I really want to do this. I like the team here. I see how we all work together. I see the difference we make in a lot of people's lives, all the different areas that, you know, the community comes together and we put out there. The community meaning us, the Division of CART, that is our community. And it made me want to just be able to lead this into, you know, another chapter as we grow and expand, which we're continually doing. I just wanted to be a part of that. So I was lucky enough to be able to take over from my predecessor, and now here I am, hoping to build and grow each day.
I became involved in nursing actually as a child. My brother was a diabetic and he became blind, and he taught me how to administer insulin shots. So that's why I actually went into nursing. So anything I can do to help people who are sick, no matter what the illness is, that's why I got involved in nursing.
I always say, I want to serve humanity. I want to serve patients. I want to take care of them. And I know it's a fulfilling because I've been here 28 years and some patients are still here. So I know that, I guess, here in CART, we are able to take care of our patients because the longevity, not like before that, you know, they always say it's a sentence, but now I see that they live longer, and as soon as I see them, they're still here, healthy looking. I am happy and I am eager to take care of our patients. So,
my favorite thing about coming to work is I make sure I put a smile on somebody's face every day. Even if I'm not smiling, I make sure I put a smile on somebody else's face, and I guarantee I will walk out of here with at least 2 smiles a day.
My favorite thing about coming to work is the atmosphere. I work with a lot of wonderful people. We have a great time. Even in the darkest of days, we find something to laugh about. It's the camaraderie from the people at the front desk to the staff back here, to the social workers, the doctors, everyone. We have a great time. It's a very positive vibe. And that's just the people I work with, the people we see as well. We know we're all making a difference in their lives, and it shows.
There's a lot of memorable things I remember with patients, but most of it is when they talk about how the first time they were diagnosed and how hard it was, especially in the 1980s, 90s. It was so difficult. It's a stigma. Once you have it, it's like a life sentence. And though, you know, I see them crying, and you can see how they feel about it. But you know, and now I see them, they are still alive, kicking like us, and it doesn't mean to say that if you're sick, that you're gonna die tomorrow. It doesn't mean to say that you're healthy, that you will live long. Tomorrow is not promised, but with our patients here, I can say that seeing them still coming in cart here in our office is a fulfillment for me working here in cart.
So before I started working here, I worked in radiation medicine, and there was a patient who is a patient of CART who also is a patient at the Radiation Medicine Center, and I knew them from over there. And then one day I was walking through the hallway and I heard, "Is that Jessica?" And I turned around and it was him. And I got so elated because he was such a kind soul, is such a kind soul. And the welcome that I felt and the hug that he gave me and told me that he was so happy I was here and I could be part of his care again. And now every time, even though I don't technically see patients all the time, every time that he comes into this office, I make sure I go and see him because he makes my day as much as I make his.
Have I had a wonderful, memorable experience with a patient? I could never tell you just one experience. I've had so many great experiences, from treating our patients for Hep C and having them be cured, to finding that one of our patients had cancer and we never would have known, and the patient was treated. I can't say just one experience. I've had many.
Over the years, CART has brought the HIV community together on Long Island. We have achieved to make a safe place for our clientele to come. We have provided them with instruction and workshops and programs and retreats and parties and a real sense of community, all aligned with the best healthcare that could possibly be provided to anyone out there. HIV is not cured yet. We are all working towards that. And in the midst of working towards that, there's so much that keeps evolving and changing, just as life, right? Look at us from a couple years ago. Even that was a big change for all of our patients and all of us as well. I think the work really comes in with, as the population is aging and they're getting older, and how are we going to make them feel safe and strong and be able to take care of themselves when a lot of times people are fragile already? And how are we going to be able to create a healthy and safe environment for all of our patients within this world? And not only for our HIV community, but for unity in the community throughout the world. That is what we need. Everybody is equal. We are all the same. We are all deserving of love, and we are all deserving of respect.
So the progress that has been done since the 80s or late 70s is mind-blowing. It used to be a death sentence, and it's no longer. And we should celebrate that. The work that needs to be done is that we just need to really reach out to people and let them know it's okay. We have medications that can help you survive this, but also we really need to educate the younger people that HIV is still out there. And we have PEP and PrEP, and you don't have to get HIV now. My wishes for the future are that people listen and understand, as I said, that HIV is still out there. It's funny, I went to a conference once and a police officer asked me where I work, and I told them the HIV clinic. And they said, "Oh my God, you really need to be careful." I said, "Careful? Of course. Like, so part of my wish for the future is I didn't even think there was any stigmatism anymore, but I guess there is a little bit. So my wish for the future is that people try and take care of themselves and look at all the options we have, and other people know that they're not, people who have HIV are not lepers. We're all in this together.
Together we are stronger.
Together we are stronger.
Together we are stronger.